Disclaimer: for the purpose of this video, we will be using Exploring the Dimensions of Human Sexuality by Greenberg, Bruess, and Oswalt. More information about the book and how to access its contents at the end of this video. In this video, we will discuss the contents in Chapter 15, Sexual Techniques and Behavior. Sex. It is such a difficult and sometimes uncomfortable subject to touch on, especially between families, and it is rightfully understood. This sense of embarrassment is nothing new, for the new attitudes branch from past cultures, religions, and stories. Masturbation can be considered one of the first sexual experiences that one will engage in. Masturbation is the self-inflicted stimulation of genitalia for sexual pleasure. Though many religions and cultures condemn it, it is very common, especially among men. Actually, in page 524, the authors point out that Freud believed masturbation to be a normal childhood practice. And why not? The healthiest thing to do is to know the very skin that is yours. The young mind becomes curious, and masturbation is a form of exploration. The authors also point out that masturbation, the act itself, cannot be the factor of any psychological harm. That if any problem lies, it is within the person who might feel a sense of guilt or shame because of how society and religion views the practice. This can lead to uneducated or unhealthy sexual habits later on, which is why families should focus on raising educated and self-aware children. Avoiding the conversation can lead the young to find answers in the wrong places, and no one can inform your children better than you can. It doesn't have to be embarrassing or uncomfortable. Just be approachable and factual. If your children know they can ask you questions, then you have the opportunity to sway away from misinformation and uneducated decisions.
Fantasy, thoughts, images, and daydreams of a sexual nature. A fantasy is created by a person's imagination and can be triggered with internal or external stimulation. An example of external stimulation would be erotic literature or sexual attraction to another person. Internal stimulation would be thoughts. Differences of fantasies between female and male. Females fantasize more towards a scenario with detailed description. For example, they take note of the type of music that would play, colors, and objects in the place. Their fantasies involve more of a relationship and are more likely to fantasize about their current partner. Male fantasize more about having a quickie rather than on detailed scenarios like females. They take note of what their partner in their fantasy are wearing and are likely to include more than one person of the opposite sex. They also have fantasies of someone else other than their current partner. However, it is common for both male and female to fantasize about someone else while doing sexual activity with their partner. The purpose of sexual fantasies are for pleasure or to enhance sexual arousal, test or rehearse sexual activities, and acknowledge sexual feelings without acting on them. Sexual fantasies are a way to fulfill desire without hurting anyone, as it is a private and safe way of doing it. Fantasies can increase sexual relationships as long as they are not obsessive. They can be acted out with sexual partners as long as they consent to it. However, if one is uncomfortable, problems may arise.
Sexual intercourse and keeping it going. Penile vagina intercourse. This is when a man and a female engage in sexual intercourse for pleasure or in order to reproduce. Contour positions. There are many different sexual positions in which couples can engage. Men on top, women on top, side by side, re-entry, also known as anal sex, just to name a few. Partners engage differently based on desire, cultural beliefs, and being able to do such position. Sexual behavior of gay and lesbian. Gay and lesbian partners also engage in similar sexual positions as heterosexual. However, they tend to engage more in oral sex, digital vinyl contact, and using sex toys and dildos. Keeping it going. As time goes by, Sexual activity may decrease due to factors like age, medical reasons, and different things of that nature. However, as long as couples choose to continue to engage, they can use aids such as vibrators and different things to keep it going in the bedroom.
Anal and sexual behaviors of gays and lesbians. You may be wondering, what are the differences of sexual behaviors between females and males? Lesbians play a key role in lovemaking, such as the emotional components known as hugging, touching, and caressing. Oral is a common sexual activity in lesbians at 95%, and genital stimulation. Other sexual activities would be engagement in digital vaginal contact at 85%, the usage of dildos in both anus 25% and vagina 60%, tribalism 95%, anal 25%, and more. Gays are known to play the key role in foreplay, such as nipple stimulation, kissing, hugging, and petting. They're less likely to perform anal activities and more in oral sex or masturbation. Gays are stated to perform 2.9% of anal sex. According to a chapter, gay males kiss their partner 75%, next comes oral sex at 73%, and masturbation at 68%. Anal activities are done less than half of the participants at 37%. It is most common in ages 18 to 24 between gays at 43%.
Oral sex. Meow. Oral genital sex behavior involves contact between the mouth, lips, and tongue of one partner and the genitals of another. When a female's genitals are orally stimulated, which means the partner is stimulating the woman's vagina, it is called oral sex. So, oral sex for a male is when the penis is taken into the partner's mouth, and yeah, that's oral sex for men. One thing I found interesting about oral sex is the 69. So the 69 is when two partners are having oral sex, but they're having oral sex at the same time. Foreplay. Ow. So foreplay is like the physical contact that is done before actually really having sex with your partner. Foreplay is about pleasuring each other and getting each other aroused to get ready to have sex.